There we go. Thank you very much. Okay, everybody. Thank you for joining us on this day before Good Friday. This is Brian Dowd. I'm the Deputy Executive Director over Policy Operation and Compliance here at the Department of Community Health. I appreciate you joining us tonight to learn about EVV registration, particularly given that it's a 6 p.m. meeting. So thank you very much for joining us. Next, we always start out every presentation we do at the Department of Community Health with the mission of the department, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do a few very quick reminders. I'm not going to hold y'all up much on that. I'm just going to give you some quick EVV reminders. I'm going to let you know the status and where we are. I'm going to talk a little bit about our functionality phases, briefly go over some places where you can get the training resources, let you know about the new call center that's up and running. Once again, go over our communication resources, but we'll be going through those first 1, 2, 3, 4, 5 things pretty quickly. And then Joe is going to give us an update of the provider registration and how to do that. It's pretty simple. Then we'll go to talk about where we are. I'll talk about where we are with third-party vendors, and then we'll do a little Q&A. For tonight's Q&A, I am asking that we stick only to topics associated with registration. And that's just because we're getting a little bit of mixed messaging and stuff that's going on in some of our town halls, and we really want to keep these pointed so we can get the things that we are most targeted on completed, and we can really focus on that. That doesn't mean we won't answer your questions. We'll have the EVV email box you can send things into, and we're always updating our Q&A. If any question we get in the box is new and needs to be updated for our frequently asked questions. Next slide, please. So I always like to go over this quick reminder slide because I continue to get questions in the mailbox and just to me personally about what services are covered. I got one yesterday for autism spectrum disorder therapy. Somebody said, wait a minute, we need to get geared up for EVV. And I was like, no, you don't. You're not in, EVV is not for autism therapy. So I like to say, again, the two services are community living supports, whether they're consumer directed or traditional in the now and comp waivers, and then personal care services as it exists in GAP for kids, SOURCE and CCSP or our elderly and disabled waiver, or ICWP. And that's whether it's consumer directed or whether it's traditionally provided. So just CLS and PSS are the only two services that are mandated by EVV. Where are we? Today is our go live date, so that's very exciting. So it says the implementation is on schedule, and we are live today with the system. We are continuing to work with our third-party vendors to get them onboarded, and we're continuing with testing, and I'll go over that a little bit later. Training has been available pretty intensively for the last couple of weeks, and we've been doing these town halls for November. There's also multiple video trainings online and user guides that are available online. So there's multiple ways to get training. And finally, registration's open. That's why we're here today, to learn how to register, right? And the call center is available, and we'll go over that in just a second. So the graphic at the bottom goes over the fact that we've been doing that training, and we're in the midst of registration. Systems ready. We've done initial training, but of course that training will be ongoing throughout the life of EVV, as well as ongoing support through all of the training resources in the call center. Now in April and May, we're going to be doing some pretty intensive recruitment. We're going to be trying to get as many providers on board as we can so they can start using that system in May and June before it goes live with claims processing July 1st. We're also going to do any sort of system refinements associated with the new EVV system. There may be things we need to tweak. There may be some code we have to update quickly. There's all kinds of different things that you learn when you get into a big IT project like this. So this also gives us time between April 1st when people are using it and July 1st to make sure everything is ship shape going forward. Better not try and say that 3 times fast. Next slide. So this is another slide that just goes through the functionality phases. Currently, we're at 4.1, and we really are at 4.1. That's where we are today. So the EVV solution is up and running. We do have telephony available, but we won't have that exception process available for you to apply to use telephony until next week. We're going to finalize that in the next couple of days and get it posted. The call center is up also. Now, late in May, we will have the ability to start submitting claims through the EVV system so we can get all of our practice and training in on claims submission as well. And fixed devices will also become available late in May. Then 7.1, we have that required EVV use to get your claims processed. And then we're going to also add additional functionality for case manager, support coordination, care coordinator. All those case managers will be able to have their registration and look in the closer we get to July. This is just a slide to highlight training resources. We want to make sure. I get a lot of questions, and I know others do, about, well, where are the trainings? Where are the town halls? If you click on the provider tab on our email site, you can go down and see all of our PowerPoints, these PowerPoints that we're scrolling through right now, and every recorded town hall is available online as well. So that's over here to your left. And then we have implementation materials that you can also see to go through. I encourage you to bookmark and go to this website all the time because we're updating things constantly. Now, it does take us a couple of days to get the recordings up because it has to just go through a little bit of an IT process. So some of you guys write me the next day and go, hey, yesterday's isn't on yet. But we usually have it up in about 48 to 72 hours onto the website. Thanks, Joe. So this is very exciting to us. A couple of days ago, the call center came up. So we have the DCH, the EVV call center that is hosted by Conduit. That number is 833-701-0012. And again, this will also be available on the website, so you don't need to hurriedly write anything down. There is also an email address that specifically goes to Conduit and a website for chat if you want to chat through any issues or concerns you're having. We will also be putting a cheat sheet on the DCH website. I think it's already there, where you can go on and get all this information. So you don't have to write it down. You can just click on that old cheat sheet toolkit for providers and be able to pull up all the information as well. So communication resources, I've said this a bunch of times. You don't have to memorize the EVV website. I don't, and this may be unbelievable to people when I say it, and I know it is. I don't actually have it bookmarked in my favorites because I got so many favorites. I don't like to add new favorites on my work computer. So the way I get to it is I just Google DCH EVV, and it comes up. It's one of the first things that comes up. You may have to scroll down to the second thing, but it's always right there when I just Google DCH or any search engine, not sponsored by Google, DCH EVV, and it'll pop up. Also, the DCH EVV mailbox is still open, so you can submit any questions not related to registration to evv.medicaid@dch.ga.gov, and we will respond to you. Now, sometimes it takes the weekend. Tomorrow's a state holiday, but I imagine I'll be cleaning up some emails from the EVV mailbox at some point tomorrow, because that's usually what I do on my Saturdays and Sunday afternoons. So we will respond to every single question that comes into the EVV mailbox. All the PowerPoints are there. All of our flyers and announcements are on the website. Our readiness surveys are on the website. FAQs, and again, those are constantly being updated. And then all the town hall materials and recordings that we spoke of. Okay, that's it for me. I'm now going to turn it over to Joe Schnurr, who is the Chief Customer Officer for TELUS NetSmart, to go over how we register.
Awesome. Thank you, Brian. That was a great introduction. So good evening, everybody. This is Joe Schnurr, and my job is to walk you through the process of how you get registered. So let me go to the next slide here. These are the two types of registration that we're going to go through. The first is step one, which is how does a billing provider get registered? And the billing provider is the agency, most likely, that's going to be doing the billing. And we're going to talk through the different specifics of how you have to register. So the first bullet point there is an important one. It says each billing provider must register to gain access. And as a sub note to that is if you have multiple Medicaid IDs, you'll need to register for each one of those. And we'll go through that in a little bit more detail as we go through this. There is a registration guide. It's actually a really good guide that I'm going to go through. It's available on the website. I'm going to show you how to get to it, and then we're going to go through it. And you can use that guide step by step to walk yourself through getting registered. The second type of registration is how does a user get registered, right? So you're all going to have to register all your aides as examples. If you have a biller and a scheduler, all those are going to have to get access to the system. And the way they get access is through the user registration. So we're going to go through that process as well. And of course, there is also a guide, training videos, all sorts of ways to support you through that process. So I'm going to go ahead and execute out of the PowerPoint. And I'm going to open up just an internet page here. So this is just a search page on my computer. And like Brian said, I believe he said Georgia, DCH, EVV. Enter. And there are a couple paid ads here, but here's the Georgia Medicaid website right here, DCH, EVV. And if I go that, this is the DCH EVV website. If you all haven't been here, it's a great website to help you with everything that you need. All right. I guess I'm wondering why I don't have the left panel here. Anybody know, Brian?
I don't know. That's weird. I haven't seen that. Let me go and look in my own.
Joe, you're on the overall DCH page, which does include also the EVV events. So you just need to find the EVV page. So you're close to the right place.
Okay.
Should be under programs.
Under programs?
Yep.
Oh, there we go. And then
You go to, is there a Medicaid?
under Medicaid?
Mm-hmm. It should be.
Let me just go back to a search again. Because it's always come up for me.
Yeah.
I think your search went directly to a different page.
Yeah. Like
Okay.
in Georgia EV, it takes us directly to it.
DCH, Georgia, EVV. This is the events. That's Medicaid. This is for the town hall.
That EVV service providers link would have got you there.
Okay.
Click back. Yeah, EVV service providers right there, that third link.
This one. Third one. Okay.
Yep.
Ah, there we
Fingers
go.
crossed. Great.
All right, good. So that's a good learning lesson probably for all of us, to how to get to the right page, because you know that could happen to anybody. So it was a good exercise to go through that. So once you get to this page with the EVV service providers, you can see there's a lot of EVV implementation materials here. And we're going to go through some of this, of course, not all of it, but all of it is available to you. So we're going to pick this one, how to register a provider agency to use TELUS EVV. So I did download this earlier, and it is right here for a PDF. It downloads a PDF for you. And of course, you can print this or save it or do whatever it is you need to do. So let's go through each step here. So first of all, it says that up top here, if a provider agency has multiple locations with different Medicaid ID numbers, the provider agency will need to complete registration for each location. And I'm going to ask Brian to speak more about that in a little bit. Okay, so step one is each provider that's going to go through this process needs to select somebody that's going to go through this and go to the website and go through this process. Typically, that is an administrator. It could be the owner or somebody else, but it needs to be somebody that has access to all the information, because this person is going to get access to all your clients' information. Okay, so step two is that you're going to go to this website here, fortelus.com/GA-DCH. And if you download this document, you can actually even click on this and it will take you right to the page. So you don't even need to type it in. And so you can see it took me to that page. And you can see right here in the top header, there's a registration tab. If I page down, if I miss that and I page down, it says, how do I register for TELUS EVV? It says, click register to begin. Either one of those buttons, either this one or this one, they both get you to the same place. So I'll go ahead and click. And it takes me to the registration page. And I need 3 numbers in order to get access. First one is my billing provider tax ID, or many of you know it as your EIN. So most providers will know that number, and certainly the person that's assigned to go through this process should know that number. The next number's a little trickier. The payer provider ID, or also known as the Medicaid ID. And I'm going to have Brian make a few comments because there has been some confusion around this number. Brian?
Yeah, sure, Joe. So first of all, what I'm going to tell you is just an example I'm making up. So just kind of think about it in the way that you have registered. If you're an agency and you're working in multiple providers or you're working in multiple locations and or multiple waivers, you have multiple IDs, right? So Brian's House Inspiration, my company, it's going to have a base ID of 12345, right? And then I enrolled to be a PSS provider in, let's say, Source first. So my first number might be 12345A, or that may be my payee number. So my first number may be 12345B, and I know that's my source number, right? My source PSS number. But I'm also in CCSP, so I have 12345C. Then maybe I have an adult day health center, so I have 12345E as my fourth number, or fifth number, whatever that is. And then in ICWP, another waiver, I provide PSS too. So I've got 12345F. If I try and put my adult day health number in here, it's not going to work because we don't do EVV for adult day health. We only do it for PSS and CLS. But if I want to get everybody on, I need to register not only my CCSP number, but my source and ICWP number. So for PSS or CLS, each individual number that is associated with that needs to be registered so you can get all your members in.
Awesome. Thank you, Brian. And hopefully that was helpful for you all. I know it's been helpful for me to understand that. There has been some confusion around that, and so that's why I asked Brian to go through that in detail. Of course, if you are confused on that and you can't figure it out, you can always call support, and support will have the specific numbers so we can help you out with the correct ID. But several providers have registered already, and they have been able to select the right ID numbers. The third number on here is the zip code, and that's just the zip of the location that you're registering for. So hopefully that should be an easy one. And then you select I am not a robot, and then you hit the submit button. So pretty easy. The hardest part is just that middle number. But I have confidence now that Brian went through that you all will not have a problem with that. Okay, so I'm going to go back to the guide. So we went to the website. Step 3 was we entered into 3 different numbers. Step 4 was we checked I'm not a robot, and we hit submit. Okay, step 5. So it's going to bring you to the next screen, and that's this screen here. Now, this isn't filled out, but for your agency, it will, because what's going to happen is when you fill in those numbers, this system is going to look it up. It's going to find you, and it's going to fill in all this information. And I know there's 2 arrows here. We need to make an update on this. We're going to remove this 1 arrow. The only thing you need to do here is to fill in the email at the bottom. That's it. Everything else will be filled in. You don't need to touch it. I don't think you can change it anyhow, because we don't want you changing the data that's coming over from the feed from DCH. All you do is you put this email, and this is the person, the administrator, or the owner that is registering. They're going to put their email. Why is this important? Well, this is important because the login information into the EVV system is going to go to this email. And that person is going to be set up as the first user for your agency. So just know that and make sure you select the right email. And then you're going to hit submit. After you put your email in, the submit button will illuminate, and you're going to hit submit, and that's as easy as it is. Now, step 6 will be that email is going to be auto-generated. So again, this is the address. As soon as you hit submit, the system is going to send the username and password, a temporary password, to that email address. Now, we ask you to go to your email. You might want to give it a couple minutes, right? The system has to go and find everything. And so, but the email should pop out within a few minutes. If you don't see it in about 5 or 10 minutes, then maybe there's a problem. Now, I do ask, check your spam or your junk folder, because there's a possibility that it went there. So the email should come over very quickly, and then you obviously open up the email and you will see your username and password, and it will also have a link to the portal for you to get signed in. So you'll click on the link, you'll sign in with your username and your temporary password, and then the system will force you to change your password. And just so you know, the passwords change every 45 days. So you're going to have to change that password every 45 days for security reasons. Okay, so that's it. Once you've logged in, you're done. Now your agency is registered, and whoever has done that is really the first user on the system. So again, this guide is here. It's meant to walk you through step by step. We'll update it and remove this arrow, and you should be all set. And again, several agencies have been able to get through this process. There have been a few that got confused. They called support, and we've been able to help them out. So we hope that all of you start registering very shortly. Okay, so back to the PowerPoint. We said we would go through billing provider registration. We just went through that. The next one is, okay, I'm registered. How do I add my other users? Okay, so if I go back to the DCH website, you can see that there is, how do I manually add users to EVV? So right here, this PDF. So I also downloaded that one. And I'll walk you through this one. Again, step by step, pretty easy to use. So now this, again, is assuming you've already registered, you've already got access to the portal, because what you're seeing here is a picture of the portal. Now you can see in this example, they already have several of their users already loaded. Of course, yours will be blank until you start to load them. Now, remember, we went through this process in previous town halls. There are videos available on the training sites. Hopefully, you've all have went to the live webinars. And if you went to the live webinar for an administrator, which if you're going through this process, you are most likely an administrator, we go through how to upload users. So there are multiple ways that you can learn how to add users. I'll walk through it briefly just so you can get an idea how it works. So I am on the user tab here. This is my left menu in this screen. And I go under users, and there's a little plus sign up here in the upper right. So you can see we circled it. When you click on that, this little box opens and it says invite user. And it says search by the full email or phone number. So here's why we do this. There's a chance that a user has already set up a profile in the system. As we know, aides work for multiple agencies sometimes. It's also possible that an aide used the TELUS system in a different state, maybe they moved, all sorts of reasons why they may already have a profile in the system, as we have tens of thousands of users that have already set up profiles. So we don't want you to set up a duplicate account. So what we say is, ask your user for their email and or phone number. And when you type it in and you hit this search, if they have a user, if they already have a profile, it's going to show you, it's going to come up with this little window. Now this one just says do not use, but it will say the first name, the last name. It will give you part of the phone number and part of the email. And if you say, oh, that is my user, my aide that I'm trying to add, then you just hit invite user. And what it does is you don't need to set up a profile for that user because they already have a profile. All you're doing is inviting them to your agency. The reason we do this is, number one, we only want aides and all users to only have one profile. If they have multiple profiles, it can create issues with their system. So we don't want to do that. And then secondly, as a user, you don't want to have multiple logins. So we set up the system to be very flexible for the users. They only have one login. And then depending on which visit they're going to do, it will select the right provider account. So if an aide works for 2 or 3 different agencies, they can have one login and they can see all their visits across all their different providers, which is very helpful for the aides. They don't have to remember, oh, that provider was this email and this provider was a different email. And then they would have 3 separate accounts, which we really don't want. So that's why we do it this way. I thought it'd be helpful to explain that. And you can see there's a note over here that the user will have 36 hours to accept that invitation, or it will expire. Same as when the billing provider registers, you also only have 36 hours. So what happens if I don't sign in within 36 hours? Well, the answer is you will have to have somebody reset the password. Now, if you're setting this up for your aides, you as the administrator can reset their password on the portal. And again, that's all in the instructions of how to do that. If you're a first-time biller administrator and for some reason you didn't follow through and get logged in, then you're going to have to call support to have them reset your password, because there's nobody else in your agency set up to reset your password for you. You're the first person. So hopefully that makes sense. Okay, if for some reason this user pops up and you say, nope, that's not my user, then you have to hit invite a different user. And then most likely we won't have another user with that email or phone number. And then it will say no user can be found. And then you'll have to set up a profile. And this walks you through over here on the left, all the items that you need to enter to set up a user profile. It's pretty straightforward how to do it. After you do the first couple, you'll be a pro. And again, if you don't like user guides, there's videos, there's the webinars, there's multiple different ways that you can walk through and learn how to load users. One last thing I'll share with you is if you have a lot of aides, there is a template that you can download, and you can do a bulk upload. I'll go back to the Georgia website, and here is the TELUS EVV users upload template. And it's a spreadsheet, so you can download this spreadsheet, and it gives you columns and rows, and you enter in the information that's required. It's the same information that I walked through with you in this guide. It's all this same information: first name, last name, username, phone number, all the same stuff, but it just does it in a big Excel sheet, and then you can upload it in bulk. You basically save the file to your computer. There's a little cloud icon here. You click on that, and it helps you upload it. Again, all of those instructions are on the videos and the town halls and the user guides. So if you need, more help with that, plenty different ways that you can learn how to upload that bulk file. If you only have, 10 or so aides or users to load, it's probably easier just to do them one at a time. It's really your preference which you like better. Either way is pretty quick. Okay, so back to our PowerPoint. We went through billing provider registration. We went through the guide. I showed you where the guide was on the website. We talked about how to upload users and get them registered. They're going to go through a similar process. Once I load them, they're going to get the automated email. They're going to have to, if it is an aide, they're going to have to have downloaded the TELUS mobile app, which again, there's a video on how to download the TELUS mobile app. And that's in all the training. And then they'll have their email that'll give their username and their temporary password, and they'll have 36 hours in order to go ahead and do that and have their sign in. Then they're ready to go. So hopefully that gives you a good overview of registration. Those of you who have questions, we look forward to taking those. Brian, I'll turn things back over to you and let you give the last few updates.
Okay, sounds great. So first of all, we would like to give you guys a little bit of an update on where we are with third-party vendors, because we know folks like to see that information. So let me tell you how it's color-coded. You probably know this before. So if you see this peach one, the one that's in peach, that's one that has declined integration with us. A third-party vendor that has said, the one third-party vendor that says, hey, we're just not interested. So if that is your third-party vendor, you either need to sign up and enroll with TELUS pretty immediately, or call up this third-party vendor and say, what's the plan? That's a business decision for you. You can always just sign up and use the TELUS system and not worry about that third party if that is what you choose. The folks that are in black are folks that we have not yet got a contract with, but there has been some initial contact there. So we're still hoping that, you know, those will get a contract here pretty quickly. The ones that are in blue are the folks we have a contract with. So they have said, yes, we want to integrate, and we're starting to gear up to the green stage, which is testing. I'm really excited by this slide. I said this yesterday because when we were first looking at it, there was only like 2 or 3 in green, and now there's a bunch more in green. So that means we're moving forward and things are going good with the third-party integrators. The next slide is just about town halls. I'll give it a second. There it is. So we will have more town halls like this one in May, June, July, and in August. So you'll have to hear from me and Joe again, probably, maybe not. Maybe we'll have new people, but we're going to be focusing only on the topics that you need. So we don't even have topics yet because we want to make sure that what we're addressing is what you are having most trouble with, or we may just do an open Q&A. We may sit here and just answer questions the whole time. That may be our focus. Okay, I think that takes us to our Q&A portion of the presentation. So we got a few minutes here, so let's see what we can go to. But I do want to let folks know before we do that, that you are always, always, always welcome to use the evv.medicaid@dch.ga.gov website, and we will answer you there. Okay, first question. Good evening, everyone. I always like to be greeted. That's nice. I have a quick question. When our employee adds notes after the shift, can the goals established in the ISP also be tracked? Do employee-employer still track those on paper? I'm sorry if this is a silly question. That is not a silly question in any way, shape, or form. So right now, tasks can be captured by EVV, but not the overall goal. We are still talking with DBHDD about modifying that policy, and hopefully we'll be able to do that in the future months. But for now, you will need to continue to track goals on paper, not tasks, because they will be captured, like what you're doing for the day, if it's cleaning or helping with activities of daily living, like bathing, that will be captured. So you don't need to double document it, but you will need to document the goal of the service. We had a few questions about self-direction, so I answered those within the chat while we were going. How does EVV process work with Appendix K? It works, it's really not related to Appendix K other than you have to document the services through EVV, whether or not there's some allowance in Appendix K for a family caregiver or otherwise during the public health emergency. There's really the expectation of EVV, which is a federal expectation, is out. There's no allowance to get around that in Appendix K. And I have been asked that question a couple of times. Well, during the public health emergency, can we not have to worry about the staff that were hired, that were family, that were associated with this? And the answer to that question is no. You know, everybody, if we remain in the public health emergency, when we get to the claim section, we'll need to be utilizing the EVV on 7.1. Okay, Let me go down to the next one. I got to get through a few of these because I answered them online. So I'm sorry about that. The next question is, we use access care when the integration process happens. Do we know if this info will transfer over, or do we need to put everyone individually into TELUS if you have a third party? Joe, can you help with that one?
Sure. So Access Care, we have integrated with them in other states, so we know them well. And the way it will work is you will do EVV in your Access system. And then once the integration is complete, that data will flow over through the integration over into the TELUS system. So all your visits with all the information, your client, your aid, all the identifiers. That's what that's what the integration does. It identifies what information we need to get from your vendor into the TELUS system so that you can do billing and claims correctly. So all that information will come over. It will, then you'll log into your TELUS claims portal, the administrative portal, and you will go through the claims component and submit your claims through that platform. So even if you're using third party, you're using the TELUS platform for claims. You won't use it for EVV because you'll use your third party system for EVV, but then that data will flow over so that you can bill your claims through the TELUS platform.
Is it possible for an aide with multiple agencies to fill tasks on the wrong agency provider task sheet? I would say no, because it signs in specifically to the agency, right, Joe?
So can you repeat that one more time?
Sure. Is it possible for an aide who works for multiple agencies, I'm just adding words because I like to do that, to fill the task on the wrong agency or task sheet, to, essentially clock in and clock out for the wrong agency?
Right. So first, I'm assuming this question is if you're using the TELUS EVV, right? Because I can't speak to if you're using a different system. If you're using TELUS, what would happen is, let's say an aide works for 3 agencies, and let's say they have 3 visits on the same day with 3 different recipients, one from each agency. Maybe they have a morning, a midday, and an afternoon visit. So when they pull up their TELUS mobile app, they're going to see their calendar, and they're going to see the name of their client for each visit, and they're going to have to select the correct one. And when they select it, it's going to give a bigger screen with their client's name and all the specifics of the visit and what time it's scheduled for, all the details. And then they're going to choose to start the visit. So, and then they check off their task later on in the visit when they're done. So, of course, if they choose the wrong recipient, then yes, they're logging a visit for the wrong recipient, but that would be a user error. Does that answer it, Brian?
Yeah, that answered it very well.
Okay.
The next question says, can we upload the template multiple times, and will the system discard existing users?
You can use the template multiple times. It will, I haven't used the template in a little bit, but it will alert you if you have a user on there that's already in the system. So I think it like gives you an error message or something like that. So you do need to have just the users that the new users that you're trying to upload. So if you are trying to upload one that's already in there, it will give you an error for that.
What if the user has 2 emails but doesn't remember which one was used? I think that's like anything else, you're going to have to try the other one.
Right. I would enter them both in there and see if you can find the correct one. So I'd say, hey, give me both emails. I'd put it in the search bar. If the first one doesn't work, try the second one. You should be able to find it.
That's what I do in my real life when I can't remember. And I turned 50 recently. There's lots of stuff I can't remember. I have multiple locations and provider numbers. Is it possible to have one login? Nope. We went over that a little earlier. So you need to register for each of your provider locations.
Oh, so let me update that, Brian. So I think
Okay.
what they said is, can they have one login?
Oh,
So-
one login. You're right. I'm sorry. It's
Yep.
not registration.
Yep. So as long as every time you register, you're putting in that same email, then you're going to be registered with one login for each agency. And then you're going to have a drop down at the top of your portal, and it will allow you to go from office to office. You'll see like a drop down. It will list all your offices. And you can actually, the system even allows you to go in and kind of name the offices differently, because, if you have 10 offices, it could be confusing, and you could call it office 1, 2, 3, 4, 5, or whatever you want. So it does allow you the flexibility to kind of name them so you can remember how to jump back and forth. Somebody told me today that they use our system in multiple states, and their drop down has 43 locations. And so they had to get very clever on how to name it so they could remember which office they were trying to get to effectively. So again, as long as you use the same email, you'll have one login, one password, and you'll be able to jump between the offices by that drop down.
Thanks. Glad you were here. Do all users have to have an email address?
I believe the system allows you to have either an email or a phone number, one or the other.
Will we
But we
have
need-
to have? Oh, go ahead. Sorry.
But when the billing provider registers, it will only take an email.
Thanks for that.
Sure.
Will we have to have different admins for each provider account?
No, you don't have to. You can, but you don't have to. You can have one admin over multiple accounts.
That's kind of your own business decision there.
Mm-hmm.
Our company is using a third-party vendor software. Do each of our caregivers still need to register in TELUS?
No. In the integration, we will get all your caregivers through the feeds. So when they start sending the data over, we will get all your caregivers and all the identifiers through that integration.
What about skilled nursing? Nurses have to clock in and out? No, it's just CLS and PSS. So if they're billing a CSS or PSS code, then yes, but most of the time they're billing a nursing code. CCSP has been down for the last 2 days. I believe you sent me an email, so I'll follow up once I've had a chance to research your email. If not, please send me the provider ID for CCSP that you've had trouble registering with, because I would like to research that, because we haven't seen that process. So please send that to this email that you see on your screen, and I'll research it and individually get back with you. Thanks for that. The next question is, will the notes and access care be transferred to TELUS?
We do not get notes in the integration, so no.
We already answered that one. So this one, are we to set up a user's profile prior to inviting the user to register?
So by adding the user, you are creating the profile. Again, if they already have one, you search and you'll be able to find them, and then you just invite them. If they don't have a profile, what happens is you set the profile and you invite them all in one process.
Next question is, as a family caregiver, how soon should I register with TELUS? So if you're a participant directed individual, then that will go through your FI. If you're in structured family caregiving, that is not covered by EVV. If you are hired as an agency through an agency, a traditional agency, as a family caregiver, you need to get with the agency that you're hired with as far as their process on registering. They should be registering here now so you can get used to using the system. Can you set up the provider and user at one time and set up users at another time? I believe that was the question.
Yeah, I believe what this is saying is, can I just register my agency and then add my users later?
Yeah.
And the answer is yes.
Did not see Continuum on the list. Are they going to use a third party? We're still working with Continuum, and there will be more information on that in the future. We'll let you know, as we said in the participant directed specific town halls last week, that we would get back with you on that. If you have not had an opportunity to listen to or participate in the self-directed or participant directed town halls, please go back and listen to those. They're very important, and they were targeted for participant-directed and self-directed individuals. And it talks about the fact that we're going to have future trainings and what the timeline is. So please go back and access that one. I really appreciate you being here today, because I want the self-directed and participant-directed community to be continually informed of everything that's going on. But it's really important you go back and listen to that targeted presentation. Last question we got. Can an agency have more than one administrator?
Yes, they can. We don't put any limit on the number of administrators.
But they need to be thoughtful about who they choose as their administrators. I've heard you say that in presentations, right, Joe?
That is correct. In fact, when you go to choose an administrator as a role, we'll even give you a warning just to alert you of the seriousness of giving somebody that privilege, because they will have access to all your clients' PHI. So you really do need to be careful with who you give that role type to.
Thank you. I just wanted to reemphasize that before we close up for today. Okay, that's all our questions. I once again want to thank everybody for joining us. I hope you have a good weekend. For those of you that are on spring break next week, I hope you have a good spring break too. Thank you, and you have a good night.
Thank you, everybody.